I want to talk about my experience to obtain this extreme laser makeover with different kind of lasers. In fact, 2 lasers. These are my conflict of interest. And these are my tools or my toys I use every day at my office. CO2 laser, a quick switch laser, IPL, diode laser, and a platform of radio frequency. These phrases are in continuous fight on my mind when I start with an appointment with a new patient. Better and fast result, but of course with worse and prolonged recovery time. This is true. Less and slow result, but with gentle and shorter post-treatment recovery time. This is another fact, and you need to discuss quite well with your patient to decide which kind of laser, which kind of treatment you want to choose. In this case, in the cases I'm going to show you, I select the first phrase. I use a CO2 laser, 10,600 nanometers, complete affinity with water. In compared with other laser, ablative laser, the CO2 obtain a great coagulation effect. That's why I obtain not only ablation, I can reach all the layer of skin to get improved. And not be afraid to pass several times in the same area because it's a fractional laser. We always have, even if you pass 4 or 6 times, some part of untreated skin. That's why you obtain a complete healing restoration. Even if you perform the stacking mode 2 or 3 times in the same dot, is still safety treatment. I show you the way I work. As you can see here, I made a stacking mode and I overlapping of 50% in each passes. Because I look for that, the iron effect is similar if you pass the iron over the fold in t-shirt or the shirt when I'm doing that over my patient or the face of my patient. As you can see here, not only was successful to erase, as you can, all the pigmentation, at the same time reduce a lot the wrinkles around the periorbital area. Only one session, but really aggressive parameter, as you can see here, 120 millijoules in deeper part of the skin. Another great case, a lot of wrinkles, a lot of folds, and you obtain this kind of reduction if you be aggressive. As you can see here, in only one session, but with this great high of energy. Another case, great photo damage, only one session. We can be able to reduce the pigmentation, to reduce the wrinkles, and at the same time reduce the size of the folds. And look about the wrinkles on the lips were reducing too. One of my best cases is a patient that I performed a plastic surgery in the past, facelift, and she looked me for a second case, a second turn of facelift. I said, no, it's not the indication. The indication is only CO2 laser. And this is my great result after 2 sessions. As you can see here, not only, again, reduction of wrinkles, pigmentations, get improved over the upper and lower lips. At the same time, if you can see here, shorten the measure of the skin in the upper eyelids. When I mention laser and wave frequency blepharoplasty, I mention when I'm doing out of the surgery room at my office, without surgery. These patients have the complete indication for a surgical procedure. Blepharoplasty is the ideal treatment, but the patient is an old patient of mine, and she asked me for no surgical solution. You can see here excessive skin in the upper eyelids, folds, and excessive skin in the lower eyelids, wrinkles, fat pads. Well, this is that I choose. I choose a CO2 laser with these parameters in only one session. After a month, she still witnesses, of course, but after 6 months, this is my result. Of course, she still has the fat pad, but look the quality of the skin and the same patients in a close view, and again, without the color in the photo to measure well the result. And the best part is the patient is still with me, is still my patient, and after a year, she still have some improvement in the area, and after 2 years, she still have some improvement in the area too. Another patient, 80 years old, with a lot of contraindication for a surgical procedure by the age, by his health, and by the relationship because they don't want to give a surgical solution for her. And this is the way I obtain this kind of result. Again, reduction on the wrinkle, it get improved in the area, but look the tail of the eyebrow. I obtained a lift effect only by the CO2. Another case in which I use the stacking mode, it means I plus several dots in the same point, several shots in the same dots, as you can see here, and the way I contain this reduction. Well, when we try to treat acne sequelae, always remember that it's the same as multiple scars, that in some cases it's impossible to erase all of them, but in this case especially, I perform 3 sessions every year, every main month of the year with these high parameters. And again, I obtain this iron effect as pass an iron over this fold, over these scars, and this is the improved I obtain. Another difficult patient, FIP-4, as the color of my skin. You know for sure she obtained a PIH, prolonged PIH, no less than 6 months. But I prefer to handle that, try to obtain these great results in the cheeks and over the temporal area, as you can see here. Another difficult patient from Asia, and the way I obtain this result only by CO2. I don't perform subcision, I don't perform filler, I only use CO2 in 2 sessions with these high parameters. And of course, as I mentioned, prolonged PIH and prolonged erythema. All the patients with FIP-4, I try to use this formula 1 month before and 3 months after the treatment to reduce the time of the PIH. I was invited to send this conference in SCAR meeting 2021 to show the improvement in one of my patients, and the way she measured, I changed completely her quality of life only by a laser treatment. And here is the patient that I show, and I show you right now in a high profile view, only 2 sessions with high parameters, and the same patient in a complete profile view. A great reduction of all the scars. Other ways to obtain an external laser recovery with CO2 is using the laser handpiece and play with the focus and unfocus way to send the energy. For example, trying this angioma over in the lips of upper eyelids. Of course, you can do a dye laser. Of course, you can use needle yak laser. But in my case, I decided to use this CO2 in the focus way to obtain this type of result. One of the best indications of the CO2 laser is the treatment of this of the xanthelasma. Look, this case, if I try to perform with the surgery, I am a plastic surgeon, I'm going to have a mistake, an error, because of course I'm going to have great scar and retraction and many problems over the periorbital area of my patient. And with the CO2, this is the kind of result in 2 sessions. And another great result and great extreme laser recovery you can obtain in patients with rhinophyma. After 2 sessions, you obtain not only aesthetic solution and at the same time function solution, because the nostril getting bigger and the patient can get successful a way to taking air, as you can see here again and again. Yes, the way we can increase the size of the nostril. Finally, my take-home message to finish my presentation. For me, CO2 is the best assistant for any plastic surgeon office or any aesthetic medical doctor. The extreme facial recovery can only be achieved by CO2 and with extreme parameters as I show you. Don't worry too much about prolonged erythema and PIH. Handle it, mention to the patient and tried it several months to obtain the best result as I show you. And solve skin is not the same as solving skin quality. Not all the matter or use a scalpel. This is a message usually I send to my colleague, the plastic surgeons. Thank you so much.